Welcome to another interesting video with fun and unknown facts. Hope you will enjoy the video. Let's get started. Please do subscribe for more videos.
The World Health Organization on Tuesday warned the new COVID-19 Omicron variant is spreading faster than any previous strain, and it is probably present in most countries of the world. Omicron is spreading at a rate we have not seen with any previous variant, who Director General Tedros Adhanom Ghebreyesus said during a COVID update in Geneva. 77 countries have now reported cases of Omicron. And the reality is that Omicron is probably in most countries, even if it hasn't been detected yet. Tedros said the WHO is worried that countries are dismissing Omicron as a mild variant. Though Omicron is more contagious, it is not yet clear whether the strain causes more mild or severe disease than past variants of the virus. We have learned by now that we underestimate this virus at our peril, Tedros said. Even if Omicron does cause less severe disease, the sheer number of cases could once again overwhelm unprepared health systems, he said. Tedros warned that vaccines alone will not protect countries from Omicron, emphasizing the importance of masks and social distancing. The Omicron variant significantly reduces the protection against infection provided by Pfizer and BioNTech's two-dose vaccine, according to preliminary lab data released by the companies last week. Scientists at the University of Oxford published a study on Monday that also found the Pfizer and AstraZeneca vaccines are less effective against Omicron. However, the two-dose vaccines likely still protect against severe disease. Pfizer and BioNTech found that a booster shot provides significant levels of protection against Omicron infection. The WHO Health Emergencies Program said mitigation measures like masking and social distancing won't fully stop transmission of the virus, but they will reduce the pressure on health systems around the world. Ryan said governments around the world need to prepare for a wave of infection by making sure hospitals have the staffing, triage and oxygen supplies in place. He also said governments need to keep pushing for the unvaccinated to get immunized. Health systems are weaker now than they were a year ago in reality, he said. So unfortunately, sometimes you can get up after the first punch, but it's very hard to get up after the second. And that's the difficulty. We're relying on health workers of the health system that have been weakened by this response. Tedros said the WHO is worried that wealthy nations rolling out booster doses for their entire adult populations will exacerbate vaccine inequity around the world. He made clear the WHO is not against administering boosters to people at risk of severe disease, but the main priority should still be vaccinating those who have not received a shot yet. The WHO director said 41 countries have not yet reached 10% vaccination of their populations, and 98 countries have not reached 40% vaccination of their populations. We also see significant inequities between population groups in the same country, Tedros said. If we allow inequity to continue, we allow the pandemic to continue. Ryan said blanket travel bans create a false sense of security, because variants like Omicron spread in advance of detection. The US last month banned visitors from South Africa, Botswana, Zimbabwe, Namibia, Lesotho, Eswatini, Mozambique, and Malawi. Countries have a right to defend and protect themselves, they have a right to control their borders, they do it for all kinds of other reasons, Ryan said. But it must be done in a way that maintains to the maximum extent possible the free movement of people, individual human rights, and with due regard for the economic impacts that such measures have on countries. Omicron is almost 4 times more infectious than the original strain and twice as infectious as Delta, according to lab work with a synthesized Omicron variant at Massachusetts Ragon Institute. South African hospitals reported that the risk of admissions was 29% lower for people infected with Omicron compared to earlier waves. Anecdotally, these hospitalized adults were less likely to be admitted to high care and intensive care units relative to prior waves. People who were infected with Delta face a 40% relative risk of reinfection with Omicron. Those infected with the original virus face a 73% risk of reinfection, according to the South African research. In many cases, it's almost as if there's no underlying immunity anymore. The two-dose Pfizer-BioNTech vaccination provides 70% protection against severe complications of COVID-19 requiring hospitalization, according to the South African study. While lower than the 93% protection from Delta, that is still reassuring. This protection against hospital admission was maintained across all ages, with only slightly lower levels of protection for the elderly. Protection was uniform across a wide range of chronic illnesses, including diabetes and hypertension. While a booster's protection is still significant, it is about 4 times lower for Omicron than for the Delta variant, according to the Israeli scientists. The Australian study of the blood of boosted people found a 4-fold reduction in how effective antibodies were against Omicron when compared to the original virus. A Pfizer pill called Paxlovid is 89% effective in preventing hospitalization and death if taken within 5 days of symptoms. Preliminary laboratory studies suggest the drug should work against Omicron, Pfizer said. A monoclonal antibody made by Vir Biotechnology is also effective against the new variant's many mutations, according to new data from early-stage studies. My guess is that when this pandemic is over, and it will be over, whether in a year, 2 years, 3 years, COVID-19 is going to become an endemic virus. It's probably going to be seasonal. It's probably going to show up the same time of year that influenza shows up. As with annual flu vaccines, maybe we need to add a yearly coronavirus vaccine, he said. We're stuck with this virus. It's going to be with us for a long time.
Please do subscribe for more videos.